Vandan to our gurus. We'll do Vandan to Lord Dhanvantari, to Acharya Sushruta and Charaka, and to Dr. Man. So today's topic is labor or prasava. So this is the healthy labor. Labor is basically a series of continuous progressive contractions of the uterus to let out the baby, which is a full term. So this allows the fetus to move out through the cervix, which has been dilated, and further to the vagina. So this starts with the before or after the estimated delivery date, which is of 2 weeks before or after. So next would be, how would you know that the labor pains which you are getting is true pains or false pains? So true pains are basically you have contractions which are very strong and are at equal intervals of time. So it usually are from 30 to 60 seconds each contraction, and it will be on an interval of 5 to 10 minutes. So this will help you push out the baby, and it will thin the lining of the uterus and the cervix so that the baby moves out easily. False pains is basically irregular cramps. You can call it irregular contractions, which are there in the uterus during before the labor. They are basically false. So they do not dilate your cervix. They do not help in crowning the baby, and the time interval between the pains are very prolonged. So there are 3 stages of labor. First one is the onset of the labor. Second one is the childbirth. And third one is when the placenta is delivered. So the onset of the labor, this is when this is the first stage. It has 3 phases. First one is the early labor. Second one is the active labor. And third one is the transition. So the labor is usually 8 to 10 hours for a primary mother. That is the first time the lady was delivering. And for other women, it can range up to 2 to 5 hours. Depends differently on every woman. So whenever you will go to the doctor, what he will do is first he will check the fetal sounds of the child to know about the well-being of the child. And second, he will do a per-vaginal examination to check the dilatation. So this video is of the fetal heart sound. This is how the baby's heart sound will sound to you. This I have clicked. It is a very small video during my internship phase. The next one is the breathing and the emotions. The mother will feel a lot of emotions, anxiety being the major part of it. So what you have to do is only you have to breathe and surrender. This is only thing that you can do. You have done all the part of your whole journey. So now you have to surrender to the doctor. And if you are a partner, you have to take care of the mother and provide emotional support. Be ready for the transportation. And if you have a second child, you can make sure that the child is in the right hands. Second stage of the labor is childbirth. In this, there is a full dilatation of the cervix, and which is usually 10 centimeters. Your uterus, the cervix dilates up to 10 centimeters, and it is usually this much. So then the stage begins where there is the thinning of the cervix, and after that the baby is pushed out. So in this, you will feel a strong contraction and the urge to push out the baby at the rectum. It is usually the sensation of defecation. So what we usually suggest the mother is to push when there is a contraction, and you will know when you will have a contraction. So, or else you will tire yourself out. So the next phase in the childbirth is the birth. So first the head comes out, then it is slightly tilted and the shoulder comes out, the one shoulder at a time. And after that, after the mother has pushed the baby out, the whole baby comes out. So after the baby is out, usually the umbilical cord is clamped at 2 ends, and with the umbilical cord cutting scissor, you usually take a cut. Usually a partner is given this opportunity. After that, the baby is given on the chest or the abdomen of the mother, and the skin-to-skin contact is maintained. Mother is given a pitocin injection of 2 cc to avoid any kind of further bleeding. In this stage, the mother is usually feeling a lot of pain. So partner is expected to give her mental and physical support, and given a proper the mother is given a proper position. This is when the baby is delivered. That's me, that I did the first delivery, and this is the baby, usually like this. The third stage of the labor is when the placenta is delivered. This is the shortest phase. It usually starts after 10 to 13 minutes after the childbirth. It can be a cramping sensation for some women, or it can be a strong pain for other women. So you just have to give one push and the placenta will be out. And this is the placenta, the delivery of the placenta. Physical changes and emotions that the mother would feel is she would be feeling at the loss of energy with all the sweat and the excessive bowel movements that she experienced. But it is important to keep in mind that the process has been almost done, and you are strong enough and you have ended the war like a hero. If you are a partner, please keep a check on the fluid levels and keep on giving her like a minor cuddle or anything, and keep taking care of her. So, yeah, this is on my part. So, thank you for giving me a platform, and I would give the chance to Dr. Shruti.
Yeah, can you just put the slide? Thank you. Thank you, Dr. Gayatri. Hello, everyone. I'm Dr. Shruti Ayurveda from Mumbai. Starting with, I just pay my heartfelt gratitude to all my gurus, my father, and our most beloved Dr. Nutan. I hope my colleague Dr. Gayatri have given a clear picture about the child labor or the stages of the labor. So carrying forward, I would like to throw some light on how yoga plays an important role in the healthy childbirth. Anyways, from preconception or the trimesters, the previous presentations and my colleagues have explained how yoga, asanas, and meditation and detoxification and everything works. So let's move directly for what happens during the childbirth. So ऐसा है कि हमने चालू तो किया है process. Now this is the perfect time and for the final product, what ma'am says. So this is for the yoga, and the main aim for this to explain is like labor involves, it needs space, stretch, and then strength, suppleness, and stability for both physical and mental health to the woman, as it minimizes the postnatal complications. Next. Different asanas, as we know, for example, Malasan, Marjarasan hai, Veerbadrasan hai, or even Vishnu Asan hai. So the importance and the postures we have learned before also, but these help the pelvic girdle to become strong, muscles flexible, give space to fetus and move towards the fixing position. They can be done with the help or support of, pillows, bolsters, or even your partner. These asanas help in making the passage for smooth expulsion of the passenger, that is fetus. Next. The other important aspects of yoga during the childbirth, it carries the number one, breathing. So a slow and steady breathing with inhalation through nose and exhalation through mouth, or even the Lama's technique, where we have been taught through mouth what we give, it will be taught to the patient or the lady, and while paying attention towards the contractions. This helps to channelize her energy for labor pains. Breathing also benefits your oxygen supply. It reduces your stress and anxiety. It increases your ability to handle contractions and act mindfully during the childbirth. Mantra chantings. Our ancient sages have given a number of divine mantras that create frequency wavelength, aligning our chakras, soul with the physical body, and even the fetus in the womb. So during severe pain or labor pain, if few of the given mantras, any of the mantra, the caregiver may know, and she said she can recite for mother, that can bring spiritual support to monitor and guide the child for its birth. A positive mindset with affirmations and visualization. It is really, it works like a miracle for the woman and even the child. A few of the affirmations like I am strong, or I know when and how to give birth to my child. My baby knows when its own birthday. These or the Mansik Yatra, that is visualization of, Sukhat Prasava, that, okay, you are going into labor, you are going with a healthy childbirth. This will bring and build confidence, lessen her anxiety, and thus help her true labor become pleasant. Then comes the counseling of the husband or the caretaker. This is for the moral support, as well as for the postures, or while just being mentally present makes a big impact on the delivering lady. And push and relaxation has, as the Dr. Gayatri has also explained us, that she has to be taught that how she has to put the pressure as we do during the defecation, and just save the energy and relax while the contractions subside, so that the avoid fatigue and have smooth labor. Next slide. Now, this is the slide just as a part of the case study, or my own journey, you say like my own birth 24 years back. So the main, my Garbhasanskar, as Dr. Kinjal has also explained how a detoxification happens. For me, I had a very good spiritual background from my family and being a Ayurveda. So I started my detoxification, and even I had 3 days fasting before planning to for conception. And after that, that is a tapa, what we say for kaya tapa. And after that, conception came positive. For food, diet, lifestyle, everything was taken care by my parents. During the 7th month, the process of a baby shower, and after that mantra chanting by my Jain guru monks was performed through Garbha Samvad, special mantra chantings. It was done for 2 days continuously, sitting with my Jain guru monks. This was very much effective for both me and my child. So with a normal healthy childbirth, with a good strong intellect and strong physique of my child, when he started speaking and forming words and sentences, he started with the mantras, and it was very, very surprising for me too. Second slide is about my gynae hospital. They would keep the healthy baby and mother picture competition. So it would motivate the patients also, that okay, for the all 9 months when you're going right from there, they are motivated. And this is my picture, 3rd day of my childbirth, and I was been awarded. The last picture is about my family in-laws. This is a 4 generations. It's my son, 3 months old, myself with my mother-in-law and my grandmother-in-law. The main purpose to tell this journey is a healthy childbirth can be given by diet, lifestyle, and more, with near and dear ones' support. So this fruitful process can bring pleasant memories and enhance good maternal, mental, and physical health, eventually turning to healthy procreation. A better way, what I feel, is to give back to society with healthy future generations. I would like to end my session with paying thank you to Dr. Nutan very much, because she has brought out me from the cocoon, and the entire AYG associates, all the teachers, technicians, everyone who has helped us and giving this wonderful platform and wonderful friends over here. Thank you so much.